My name's Emily Stone and I'm a respiratory physician at St Vincent's in Sydney. So as a treating clinician, I think my role and that of my colleagues is absolutely crucial. I think many patients who smoke are really looking for their treating team to recognise this as a serious problem, as serious as they think it is, and something that's very difficult for them. So I think we have to recognise it, put it on the table and offer appropriate help. Well, in an ideal world, it's essential. But I think in the real world, there's often not enough time. It might be just a matter of weeks or even less until the surgery happens. But it's never too late to start stopping. So I would work with patients to help them even reduce as they went towards their surgery. I think that we can have more impact than we realise. I think that patients who are struggling to quit smoking, particularly in the context of a stressful time like a cancer diagnosis, they need help. And that help should come from the leaders of their team, who are often the senior clinicians. And if we don't recognise this problem, maybe nobody else will. So it's essential. It probably depends on the setting. Many of the places where I work, we sadly don't have a well integrated approach to smoking cessation. And often this is something I do during the clinical consultation. So it's just me and the patient or the family. But certainly it's something where we should all work together. The treating clinicians across a cancer centre or anywhere really, and the allied health staff. It's very much a team effort, including the patient's general practitioner. Well, I don't hesitate. I always ask if somebody's smoking, and if they are smoking, then we talk about it. I don't want to leave that issue alone. It would be very rare for me to sense that that was an issue I couldn't discuss, and obviously the conversations are tailored to the situation, but it has to be done openly, and most patients respond well. So I rarely encounter complete resistance. I rarely encounter people who don't want to talk about it. Probably the most common form of resistance I would come across would be people for whom smoking is tangled up with other issues like alcohol intake, significant mental health issues, and significant life stressors like difficult relationships or a combination of factors. I do try and understand and empathise with complex situations, but I do keep the issue on the table, and it's very much one of offering support and recognising this as a difficulty. I do not see it as a point of criticism at all. Well, that's where the conversation has to continue and remain open, and I go into detail about why they might be having difficulty, and there's a whole range of possibilities, but try and find the points at which they need more help. So again, in an ideal world, people would quit rather than reduce. But reducing cigarette intake can be the step on the way to quitting. And so I see that as a point of success and something where we would continue to work.